Chronic cystitis is an inflammation of bladder which lasts for several months, sometimes for several years. It causes pain in pelvic area, and this pain worsens during bladder filling, and it will relieve during emptying bladder. And it causes frequent urination, urgent urination, burning sensation during urination, and these symptoms are important enough to disrupt normal daily activities and normal daily life. And what causes chronic cystitis? It's dysfunction of bladder wall. Exact underlying cause is unclear, but it is thought that underlying inner lining of bladder is thinning, and it becomes more sensitive, and even presence of urine in the bladder can irritate this bladder inner lining and cause symptoms. And this disease, also called interstitial cystitis, and primarily affects women, and also it causes painful intercourse and sometimes causes relationship problems. It's not acute cystitis. Acute cystitis and chronic cystitis are fundamentally different diseases, because during acute cystitis we have bacterial infection in most commonly. More than 90% of cases we have bacterial infection. But in chronic cystitis we have hypersensitivity and irritation of bladder wall, and here bacterial infection is not important player. Maybe it can be associated sometimes with bacterial infection, but it's not primary and it's not important cause here. That's why we will discuss top 13 management methods, how we can manage interstitial cystitis, because it's difficult to diagnose, because there is no clear criteria which we can say that it's definitely chronic cystitis, and we have no single treatment. We have no definitive cure for interstitial cystitis, and we will discuss 13 proven methods which are important management of chronic cystitis. First is avoiding acidic foods. Acidic foods can further irritate bladder. That's why avoid caffeine, alcohol, spicy foods, citrus foods, tomatoes and cranberries are important, and it improves cystitis symptoms. Alkalize urine is another method, which means eating more vegetables, especially leafy greens such as spinach and kale, and root vegetables such as carrots, beets, green beans, peas, and fruits. Also, some fruits are alkalized, such as melons, bananas, avocados, and coconut, and most nuts and seeds also, such as flaxseed and pumpkin seed. Third method is scheduled voiding. What means scheduled voiding? It means that first observe how many times and when you go to toilet, and gradually try to extend these intervals between bathroom visits. For example, if you go to bathroom every 1 hour, try to go for a week 1 hour and 15 minutes. And when you adhere this schedule, then try go to every 1 hour and 30 minutes, and etc. Gradually increase these intervals every week. And it's important to make diary your bathroom visit schedule, and to adhere strictly to this your new schedule. And at this case, person learns how to extend period without going toilet. And 4 is urgency suppression techniques. And what it means: first, if you feel urgency, stop moving. It's important. At this case, this urgency sensation will subside. And second is tighten your pelvic floor muscles and contract and hold it several seconds and then relax. And repeat this several times. They are urgency suppression techniques. 5 is deep breathing technique. Deep breathing technique is lie on your back with your knees bent and feet flat on the floor, and breathe slowly with your diaphragm, with your abdomen, with your stomach, and your stomach should move. That's very important. Breathe slowly and pay attention that your stomach should move during inflammation, inhalation and exhalation. And 6th method is stress management, such as yoga and meditation are important because stress has important role of chronic cystitis. That's why stress reduction is crucial. From pain medication, ibuprofen and naproxen are commonly used. Sometimes if person is unable to intake ibuprofen and naproxen, then acetaminophen. And from supplements, hyaluronic acid and chondroitin sulfate are important, and they are commonly used, and it is thought that they can help restoration of bladder lining, but more researches are needed because studies results are mixed. And 9 is quercetin. It supplements also, which has anti-inflammatory action, and it can improve cystitis symptoms, but here also studies are mixed. And magnesium and L-arginine also. Magnesium deficiency can exacerbate cystitis symptoms, and L-arginine is important to produce nitric oxide, and nitric oxide dilates blood vessels and improves blood flow to bladder, and it can help restoration of lining of the bladder, but here also studies are mixed. And if this first line treatment fails, then second line treatment is used, and second line treatment is low dose antidepressants such as amitriptyline, or Elmiron is the only approved drug, FDA approved drug, which can which can help to restore lining of bladder. It is only approved drug by FDA for interstitial cystitis, for chronic cystitis, and sometimes Botox injections. If everything fails, then Botox injection helps relax muscles of bladder, and sometimes surgery also in severe cases. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.